Welcome to Adelphi, New York statewide breast cancer hotline and support program's STEP video series. I'm Tina Conroy, and I'll be discussing Reiki and its practice. Some objectives. I will provide an overview of Reiki, discuss the 5 Reiki principles, and describe the use of Reiki in cancer care. The National Center for Complementary and Integrative Health categorizes Reiki, healing touch, and therapeutic touch as energy therapies. Focuses on energy fields within the body, and electromagnetic fields focuses on energy outside of the body. And as you can see, we have energy that are within the body and around the body. And this is for all beings and all living things. Reiki. So how do we say Reiki and how do we spell Reiki? Reiki is derived from Japan. It is a modality that has gone back many centuries. And we divide it into Rei, like the sun, like shines, and Ki, which is energy. We like to think of Reiki compared to acupuncture in the sense that Reiki comes from Japan and is an ancient modality for healing, where acupuncture comes from Chinese medicine. The Qi, or Ki, moves through the body and has energy, and we are all made up of energy. So Reiki allows us to feel more peace, healing, and reduce stress. Reiki is a complementary health approach where practitioners place their hands lightly or slightly above a person with the goal of directing energy to help facilitate the person's own healing response. Again, based on an Eastern belief in energy that supports the body's innate or natural healing abilities. Why would you want to come to Reiki, receive Reiki, and why is it helpful? It may be helpful for decreasing pain and anxiety, balancing your energy, emotional release, supporting wellness and healing. You do not need to feel sick to have Reiki. It could be anybody at any time, and it really helps with regulating the nervous system. The body allows itself to feel relaxed, and in a relaxed response, the body can heal. Reiki practitioners have different levels. Reiki 1 focuses on self-care, and you can learn this for yourself. Reiki 2 is the care of self and others. And then Reiki Master is an advanced training to work with others in the field of energy. So what is a Reiki treatment? It is a non-invasive where practitioners' hands are hovering over you or above you. Treatments may occur seated or lying down. Your clothing remains on. You simply relax with your eyes open or closed, and the treatments can range from 15 to 60 minutes. Some personal responses may include falling asleep, which happens often, or releasing emotions. And we always say that whatever happens in a Reiki treatment is meant to happen. You may sleep, or you may get very emotional, but that releases what's going on in the body. A common response is deep sense of relaxation. So what is the relaxation response? We have a parasympathetic and sympathetic nervous system. The sympathetic nervous system is the fight-flight, and that is stress, where most of us live it. It is an unregulated nervous system, the go mode, where everyone wants to move and be fast. In that sympathetic nervous system, it is hard for the body to calm down, to repair, and to heal. Reiki allows the parasympathetic nervous system to kick in, to allow everything to slow down and to repair. And due to that, the relaxation response reduces blood pressure, decreases stress and anxiety, can decrease pain, improves mood and depression, can control nausea and vomiting during chemotherapy or other treatments, and supports sleep. 5 principles of Reiki. The 5 principles of Reiki all begin with just for today. And just for today is being present. Because Reiki falls into a spiritual practice, we talk about being present, being in the moment. Just for today, I will let go of anger. Just for today, I will let go of worry. Just for today, I will give thanks to my many blessings. Just for today, I will do my work honestly. Just for today, I'll be kind to my neighbor and every living thing. These are the principles that we live for Reiki, to be present just for today. Reiki programs and research. There is many programs and research that are happening all the time. Some of them that are noted is Pamela Miles, and this goal was to collect data, Reiki treatments, over 8,000 Reiki treatments for patients by nurse volunteers. The reports are an increased quality of life and relaxation, and the conclusion is Reiki may be helpful. Another study in 2005, the autonomic nervous system changes during Reiki, and it was a preliminary study. The results: heart rate and diastolic blood pressure decreased significantly. And this conclusion, some effects on the autonomic nervous system, larger studies are needed. In 2007, the NIH funded examining Reiki effects on stress, prostate cancer, neuropathy, cardiovascular risk factors, and AIDS, integrated into cancer and palliative care. And the conclusion? Methodology challenges in research. 2015, the goal, Reiki for anxiety and depression. Use randomized trials where at least one arm of intervention was Reiki. The conclusion was insufficient evidence. In 2023, the effect of Reiki on pain in patients with cancer, a systematic review. 7 studies examined a limited number, showed a positive effect on pain. And the conclusion, more studies needed. In 2024, a Reiki program at a surgery office on Long Island, 15-minute sessions for surgical patients and post-op surgical visit. The data collection, pre- and post-survey, patients reported they were less stressed and more relaxed. And the conclusion, continue the program. This program is happening right now at the Friedman Center through Northwell Health. And as I see patients weekly, I see the differences when they walk in and when they walk out. Their pre-survey may show their stress level and their pain level being high. And when they walk out 15 minutes later, they are more relaxed and more calm. So although you can look back on all these programs and research and see that some need more programming or they were insufficient, they all show that Reiki is a large benefit that to be continued and to help people in healing. I would like to guide and invite you into a Reiki meditation. So as we do this, find a comfortable seat. If you're seated, you can close your eyes and allow your hands to rest in your lap for a moment. Keep your feet firmly on the ground. And take a nice deep breath in and a deep breath out. And begin to settle down your body, your mind, and spirit. And as I begin with the Reiki principles, just for today. Just for today, I will not worry. Just for today, I will not be angry. Just for today, I will honor all living things. Just for today, I will do my work honestly. Just for today, I am grateful. I invite you to place your hands on your heart. Place one hand at the center of your heart and the other hand on top. And as you take a nice deep breath in and a deep breath out, bring all the awareness to your heart space. Relax your shoulders, your arms and legs, And imagine at the top of your head a beautiful golden light of Reiki energy flowing down through your body, infusing your body with warmth, peace, and healing. Allow your breath to be soft and gentle without changing your breath. Notice the in-breath and the out-breath. And gently move your hands to the top of your head. As you place your hands on the top of your head, imagining the Reiki flowing from the top of your head. Feel the warmth and the peace at the crown. Place your hands over your eyes. Notice the soothing warmth over your eyes as the Reiki flows. Gently move to your throat and feel the Reiki flow down through your throat. And then move your hands back to your heart, taking a few more breaths in through the nose and out through the nose. Feel this Reiki energy flow like a waterfall from the top of your head to the tips of your toes. Feel your body relax and go deeper. As you soften your face, your shoulders, and the rest of your body. Begin to feel your body getting lighter and lighter, softer and softer, and more relaxed. And take a few more breaths. Gently release your hands, open your eyes, and come back to the room you're in, feeling your body at peace and more relaxed. Key takeaways. Increased use of Reiki, especially among women. Treatments may occur in the hospital, the physician office, or a wellness center. Reiki 1 is meant as a self-care practice. Reiki may be a part of an integrative wellness plan in cancer care, along with massage, reflexology, acupuncture, meditation, and guided imagery. Thank you for joining us. We hope you enjoy the STEP program video series. For more information, visit us online.